Hypertension affects approximately 25% of the adult American population. As this slide indicates, 130 is the new high. And management goals are achieved by either having the non-pharmacological and or pharmacological therapy. Now, pharmacotherapy should consider the 5 important drug classes: ACE inhibitors, angiotensin receptor antagonists, beta blockers, calcium channel blockers, and diuretics. Choice of drug therapy should depend on comorbidities, history of clinical events, and if there is an organ damage. Remember, regardless of which drug therapy is used, monotherapy achieves blood pressure goal in only limited number of patients. Majority of patients require multiple drug therapy. The first, most common, but potentially most challenging treatment is modification of diet. Doctors often recommend a dietary approaches to stop hypertension, also known as DASH diet. The diet contains some things that are obvious: eating more fruits, vegetables, and decreasing overall caloric intake. It is particularly important to monitor salt intake. Salt causes a general fluid accumulation in the body, which is antiproductive in hypertensive patients. Remember, more salt causes more fluid in the blood, which of course causes a higher blood pressure. Another treatment which can quickly lead to an increase in general health is cessation of smoking. Smoking can decrease HDL-C in the blood, cause malfunction in the SNS, cause problems with normal endothelial regulation, and cause an increased chance of blood clots. While whatever method a patient needs to stop smoking is recommended, the key is to stop. Another important thing is increasing physical activity, or as we say, exercise, is also important. Exercise can cause a reset of many negative pathologies that can occur due to hypertension. In addition, adequate amounts of sleep, decrease in stress, and general feelings of happiness can also lead to a general increase in health. The pharmacological treatments for hypertension. All other drugs discussed in this concept work by activating or deactivating pathways that lead to a balance in blood pressure. The first one I'll go over is the RAS systems drugs. A well-known RAS agent is the angiotensin converting enzyme, or ACE inhibitor. These drugs work by blocking the action of ACE, which likewise prevents the conversion of angiotensin 1 into angiotensin 2. Remember, without angiotensin 2, which is a strong vasoconstrictor, the body naturally cannot constrict its arteries. This in turn causes overall vasodilation. Common ACE inhibitor drug trade names end with the letters PRIL, pril. For example, lisinopril, acupril. Another way of preventing the effects of angiotensin 2 is via the angiotensin receptor blockers, or ARBs, ARB. This work by blocking angiotensin 2 receptors in blood vessels. These are commonly prescribed to patients that cannot take ACE inhibitors. Examples of ARB drugs include Cozar, Benicar, and Diovan. In regards to the alpha and beta adrenergic receptor drugs, There are four main alpha-2 adrenergic agonist drugs that work on hypertension. The oldest of this class, methyl-dopa, is currently used for pregnancy-induced hypertension. Clonidine is still used today as primary treatments. There are many more options when it comes to beta-adrenergic receptor drugs. Commonly called beta blockers, beta-adrenergic antagonist drugs have become a hallmark for hypertensive drug therapy. Beta blockers antagonize the actions of beta-1 receptors. The trade names for these drugs usually end in the letters OLOL. OLOL. Common drugs include atenolol, carvedilol, metoprolol, and propranolol. These drugs are also sometimes used with cardiovascular disease and as antiarrhythmics, meaning to prevent abnormal heart beating. Care must be taken with patients that also suffer from asthma, as the antagonistic features of beta blockers may cause bronchoconstriction due to the antagonism of beta-2 pathways. Calcium channel blockers. There are four common calcium channel blockers on the market which can be used for hypertension. It includes nifedipine, amlodipine, diltiazem, and verapamil. Specifically, diltiazem is used in emergency situations to treat atrial fibrillation or AFib. Diuretics. This class of drugs was one of the first oral medications used for the treatment of hypertension. Diuretics work on the volume of the cardiovascular system to correct elevated pressure. These drugs are normally known as water pills, as they make the patient urinate frequently. There are three main types of diuretics: thiazide diuretics, loop diuretics, and potassium-sparing agents. Thiazide and thiazide-like diuretics work on the distal renal tubules by increasing the amount of salt and water that leaves the kidneys and is excreted to the bladder. Examples include diuryl or hydrochlorothiazide, better known as HCTZ. Now, the loop diuretics work on the ascending section of the distal renal tubule, having a similar action to thiazide-like drugs, but do not last as long. Loop diuretics are usually used with patients that do not have optimal kidneys. Examples of these drugs include bumetanidine or Bumex and furosemide, or also known as Lasix. Both the drug types results in less work on the heart, meaning due to less fluid being pumped, and of course less SVR, which is your systemic vascular resistance. One side effect seen in thiazide drugs is the excretion of potassium. Since the potassium atom likes to follow the sodium atom, patients can sometimes suffer from hypokalemia. Also, same thing as low potassium levels in the blood. And this is due to the kidney excretion of sodium. So with hypokalemia can be a profoundly severe problem. To prevent this, patients are often advised to eat a healthy diet, including potassium-rich foods such as your bananas. Now, one way to prevent the loss of potassium is through potassium-sparing agents, which are usually given concurrently with thiazides. Examples of common potassium-sparing agents include amiloride and triamterene. The EDRF agonists are one of the only drugs that have a direct effect on blood pressure. EDRF works by directly interacting with vessel endothelium and causing vasodilation. The most common and widely used EDRF is nitroglycerin. It is commonly used in emergency medical to cause rapid vasodilation of occluded blood vessels. Patients that are at risk for heart attacks are often prescribed nitroglycerin or nitro. In the event they have chest pain, which is a common sign of heart attack, they are told to administer a nitroglycerin. This nitroglycerin acts to dilate coronary blood vessels, which allows much needed oxygenated blood to get to the dying tissue. Nitro often gives the patient time to get to the hospital where doctors can administer treatments to clear out blood vessels.